Facial matrix is an expression that I have coined to define the elements of the face that are arranged in a very peculiar way to provide the beauty and the youthful appearance to the face, which means that there's proportions on the face, there's angularity, there's some shadows that gives to the patient that particular appearance that when those characteristics are in a positive way, meaning that the patient has good skeletal support, good soft tissue envelope redraping this skeletal support, that give you that angularity and that shadows that makes the face to look more beautiful. It's important to address the face as a complete matrix with all the components. As I mentioned, the skeletal foundation is a very important part of that matrix. It has been said, and I particularly believe strongly, that the facial beauty is bone deep. It's not the skin deep as currently or routinely is being said about the beauty, because it goes beyond and deeper than that. Many faces that are beautiful usually have this skeletal support that are strong, that have angularity, that have facets, they have reliefs with highlights and shadows that make the face look beautiful. Along this matrix also you have to take into consideration the envelope, which has been the traditional area where surgeons have concentrated in doing facial rejuvenation. Particularly the skin, and the skin has been for many decades the area of concentration of facial rejuvenation. However, there's the other intermediate component, which is the fatty component of the face. As I mentioned, the fat atrophies with aging. You lose a volume of fat. And if you compare a youthful, beautiful face, usually they have plump, full curvatures on the face that makes and gives that appearance of youth and beauty. So the aim is trying to correct all those factors when you do facial rejuvenation. So again, it's not only the skin, but also the intermediate layer, which is the fatty component, and the deep plane, which is the skeletal support. The traditional method of doing facial rejuvenation was to pull and stretch the skin. And about the mid-60s, people and plastic surgeons started doing the layer just beneath the skin, which is the SMAS layer, also in the neck called platysma layer, to tighten the elements of the facial and neck skin. However, those redraping is usually in the more lateral, maybe a slightly oblique direction, which gives to the patient this windswept appearance to the face, which is not natural. And the problem is that with time, after a few months, the skin and the SMAS layer have what's called stretch relaxation, which means that the skin loses the elasticity from the initial pull. And the lateral aspect of the face becomes very tight, as opposed to the central part of the face, I call it the central oval, becomes loose. So now the patient has a very tight lateral aspect of the face, as opposed to the central part, which now has a recurrency of the nasolabial fold and sagging of the tissues. So the technique I have pioneered since I finished plastic surgery, which actually I was working on those since I was in residency in plastic surgery back in 1982, is to do a more vertical lift. And I heard this from Dr. Paul Tessier, who was a craniofacial surgeon, the father and pioneer of craniofacial surgery in France. Now he was doing this extended forehead lift to lift the cheek. So I saw there an opportunity to address the issues in a more deeper layer, and also to allow the mobilization of the tissues in a more vertical direction. So I extended his work. I started doing more extensive dissection to elevate the whole facial mask, we call it, in a vertical direction, which is the direction opposite to the gravitational forces that produce the downward migration of the tissues and give you that appearance of tiredness and sadness and sagging that I mentioned before.